Imagine you have severe depression, disability, and you come to your doctor, you receive this treatment, and your depression disappears in one day. Hello, and welcome to our second episode of Unmuted, the Diaries of the Virtual Psychiatrist. I'm your host, Dr. Mohammed Ali Rifai. I'm a professor of medicine and psychiatry. Today, I'm going to be talking to you about a novel treatment that's called Transcranial Magnetic Stimulation, TMS. Now, TMS is a non-medication treatment that helps people with psychiatric illness. TMS is a form of neuromodulation, which basically is changing of the brain chemistry through means other than medications. Advances in neuroscience really have promised to revolutionize psychiatry. The story of transcranial magnetic stimulation shows us how the insights in this field, where we have really ran out of medication options to help patients, have been very, very helpful in terms of new translational breakthroughs. During this episode, I'm going to have you listen to some patients who are going to give you their experience with TMS. We're going to see how the machine works, and I'm going to tell you a little bit about the history and hopefully the future of transcranial magnetic stimulation as a treatment modality. Let's talk a little bit about how this treatment modality started. Most people who are aware of the field of psychiatry think of other treatment modalities such as electroconvulsive therapy, ECT, which is a common and a safe and effective procedure that really has gained popularity over time. Now, despite the therapeutic benefit of ECT, electroconvulsive therapy, there's been significant issues with stigma that stemmed from the media depiction of ECT. In 1975, the movie One Flew Over the Cuckoo's Nest. And in 2016, a film, Suicide Squad, really have hindered the more widespread acceptance of the treatment modality, ECT, electroconvulsive therapy. Now, there we go, enters a newer treatment that impacts the global neuronal activation and can really have similar effect to ECT, electroconvulsive therapy. ECT induces a small seizure that would basically reset the neuronal network in the brain and can help depression. Now, before ECT was developed, researchers were really trying to better understand the neuronal pathways in the brain. Electricity has always been a tool because our neurons talk to each other through small electric impulses that are related to biochemistry. Now, electricity has always been used and has always been interconnected to human nature. Scientists such as Alessandro Volta, he is where the volt comes from. Scientists like Luigi Galvani, that's the galvanic response. And scientists such as Giovanni Aldini, all of their work was instrumental in developing a modern understanding of electricity and electrophysiology. Originally, they looked at it as animal electricity or galvanism related to Luigi Galvani. And in particular, Galvani's experiments on muscle contraction in frog legs. Everybody who's been through high school knows that you get these frog leg experiments. You bring frogs into biology labs in high school. That happened in 1790, and that was very instrumental in understanding the mechanism of neurotransmission and how electricity was involved. Aldini was also involved with the voltaic pile, which is an early battery consisting of alternating disks of zinc and copper in an electrolyte solution. And that was used to simulate the muscles of human cadavers as an extension of the galvanic hypothesis. These scientists understood that electricity is involved in the neuronal response in the body and the potential of electricity, as well as magnetism, to treat living subjects. Aldini improvised a device that was able to stimulate different muscles in the body, but they also discovered that they could be able to stimulate different areas in the brain. After first personally verifying that this device worked, Aldini went on to report a significant treatment, the jolt in the skull that resulted in activation of a limb. Unfortunately, the therapeutic potential for these techniques was not exhaustively explored because Aldini's research explored mostly human cadavers, not live humans. Modern research in relation to electricity, such as transcranial direct current stimulation, is also being studied. Now, with the development of these modalities, we started to understand that we could affect activation of the brain, not just with electricity, but also with magnetic fields and magnetism. The famous scientist, Tesla, for whom a vehicle is named, was also involved in continuing to using electricity as well as magnetism to basically stimulate muscles as well as stimulate the brain. Enter also the work of Michael Faraday and his contemporaries, who really interconnected electricity and magnetism. An electric current will generate a circular magnetic field around the current's axis. So basically, you pass a wire around the head and you pass electricity through that wire. The electricity doesn't pass through the body, it just creates a magnetic field. And basically, an electric current will generate that field, and that field will potentially stimulate parts of the brain. The flux of this magnetic field itself can then induce this electromotive force, basically stimulating parts of the cerebral cortex. Building on those of sciences, it was Dr. Anthony Barker and colleagues in 1985 that developed the first transcranial magnetic stimulation device for research application. Barker was optimistic about the future of the technique and its research and therapeutic potential. And in his original publication, he noted that magnetic stimulation of the cortex is particularly effective compared with electrical stimulation, which was the ECT, electroconvulsive therapy. And there was no convulsion, there was no seizure, because of the ability of the magnetic field, to pass through high resistance structures, such as our skull. This insight has been really leveraged in terms of developing a TMS coil. In the year 2004, I was at the National Institute of Mental Health, and I was working with multiple researchers who were instrumental in applying for a Food and Drug Administration clearance for a transcranial magnetic stimulation device. There was a couple of treatment avenues that different companies explored. One is what we call a figure of eight magnet. So a magnet that actually is affixed to either the left side of the brain or the right side of the brain. And we're looking at the frontal lobe, so the front of the head. The other treatment modality that was proposed was a helmet. A helmet, I don't know if people remember the character Magneto that had a helmet. This is how the helmet from TMS looks like. And in order to be able to affect a magnetic field, basically electricity would be passed through these coils. We had multiple figures of coiled. We had an H coil, and an H basically it kind of surrounds the head. And we had a figure of 8 coil. Both ultimately ended up receiving the Food and Drug Administration clearance in 2008. And basically, transcranial magnetic stimulation was strategically and non-invasively utilized to target brain regions that would alleviate depression. Now, in parallel to Barker's work in 1985, with the biological revolution of psychiatry, with the development of antipsychotic medications, with the fluoxetine Prozac revolution in the 80s, research was ongoing to find biological medicinal treatment modalities for different psychiatric illness. The metaphor of the mind as implicated in a set of circuitries and how you can modify these circuitries. The serotonin theory came, the dopamine theory came, the norepinephrine theory came, but we knew that neuromodulation and transcranial magnetic stimulation is able to stimulate those. Basically, at that time, we figured out that we had to do multiple modalities to be able to stimulate these brain areas. And because of our work with biological treatment modalities, we were able to pinpoint certain areas in the brain, the frontal lobe, the temporal lobe, and some areas of the parietal lobe as target area for magnetic stimulation. And we have subsequently, through research, through functional magnetic resonance, have theorized that the modulation of the dorsolateral prefrontal cortex, so kind of the frontmost part of the frontal lobe, which is a specific target area for the treatment of depression. Here is a sound of how the TMS machine works, where you hear a ticking sound. And you also hear a ventilation system that actually is used to cool the machine as the TMS waves are generated and the TMS field is generated. Basically, the target of TMS was the frontal lobe, and in the early 2000s, with the approval of TMS and the clearance for depression, we were able to start introducing that treatment. Initial treatment modalities with the figure of 8 coil was quite cumbersome. An individual needed to sit down for a period of about 45 minutes, where that figure of 8 coil was attached to their forehead and their skull for a period of 45 minutes, and the person received repeated magnetic stimulation cycles. The machine sounds like a ticking sound, but the results were phenomenal. Individuals improved, even though they had to devote a significant amount of time for the treatment. Here we talk to a patient about their experience with TMS and what happened when they did TMS and what did their family observe. So we're here with Paul. Paul, can you tell us your experience about transcranial magnetic stimulation?
Yes. In the beginning, I was very skeptical, but being at about the midway point, I found that my symptoms have decreased numerously. My family has noticed it in me. I've noticed it in myself. I'm more outgoing. I have more energy. And for the 20 minutes that you sit under the machine, it's a godsend.
Very
I
good.
highly recommend it.
Okay. And how's the family noticed that Paul has improved with transcranial magnetic stimulation?
Well, my mother-in-law, who's 95, just said, "Oh my God, he's smiling, he's singing over there, he's talking more,
Yep.
he's more outgoing." She said before he was just sitting there in the chair and he wasn't saying anything. He was like a zombie, like almost. But now he's more interactive and he's talking, and he seems happier, he's smiling. She said, "Oh, I got a smile on him." He said, yeah, so I mean, it
Yeah.
has made a big difference.
A great alternative to antidepressant drugs.
Yes,
Okay.
absolutely.
With no after effects or anything.
Okay, very good. So you feel this was a good decision after struggling with medications and their side effects, that transcranial magnetic stimulation could be a
Yes.
good option for somebody your age for treatment-resistant depression.
Yes, absolutely. If I would have
Absolutely.
known about this sooner, I would have jumped at the
At the experience.
At the experience,
Yes,
yeah.
yes,
Very good.
absolutely.
Very good.
Yeah.
Thank you for sharing this experience.
Yeah,
You're quite
thank you.
welcome.
Yep.
Now, as you see, TMS is improving. It used to be a cumbersome treatment that required 4 to 6 weeks of daily treatment up to 1 hour. But with our newer machine, transcranial magnetic stimulation helmet, the H-coil that was produced by Brainsway, as you see, our patients said it's a 20-minute session and basically had to be done several times a day, or could be done once a day for several weeks. And basically, patients show significant improvement in their symptoms of depression. TMS, now almost 40 years old since 1985 from Dr. Barker, is now a powerful tool for the treatment of depression. We continue to streamline it. We continue to improve on our ability to do shorter and shorter treatment of transcranial magnetic stimulation. And basically, the time between stimulation has lessened significantly. We've also been able to develop newer treatment waves. We have something called the theta burst stimulation, which is a very powerful technique that employs a very strong magnetic field to the frontal lobe that would lessen the length of the treatment. So the length decreases to 3 to 5 minutes, and the treatment could be done several times a day. We are very close to a treatment regimen where we would be able to tell our patients, come, we can treat your depression in 1 day. We are just a year or two from that treatment modality being deployed. We've also been able to really start pinpointing different areas in the brain where we would target specific treatment. We've developed something called the SAINT, the Stanford Neuro Treatment Protocol, which can utilize multiple theta burst treatment throughout the day, multiple times during the day. So a person could have 20 treatments of 3 to 5 minutes each throughout the day. And basically, you could treat your depression in a day. If you're so inclined, you can use a little bit less intense treatment protocol. You can do it several times a day, maybe 2 to 3 hours, and you can do it over a 5-day week. Imagine you have severe depression, disability, and you come to your doctor, you receive this treatment, and your depression disappears in 1 day or in 3 to 5 days. The Food and Drug Administration, after approving transcranial magnetic stimulation for the treatment of depression in 2008 and for migraines with aura in 2013, approved transcranial magnetic stimulation for the treatment of obsessive compulsive disorder. It was approved also for anxiety with comorbid major depressive disorder in 2021. And in 2020, it was also approved for smoking cessation. And there are ongoing clinical trials for the use of transcranial magnetic stimulation in the treatment of bipolar depression, in the treatment of schizophrenia, in the treatment of attention deficit hyperactivity disorder. And we have seen that treatment works very well. Here's a story from another patient who has benefited tremendously from transcranial magnetic stimulation. Tell us a little bit about your experience, how you started with TMS, and what do you want other people to know about transcranial magnetic stimulation?
Well, this is my second time. Previously, I was in different place doing that TMS, and that helped me greatly. After a while, about a year, I started regressing into depression. So I came here because my doctor retired. And I asked if you do that, and you said yes. So I decided to start then. And when I started, I was very nervous if this is going to work or not. And it is after 12 sessions, I started feeling difference and became better and better and better. And I'm done with the full whole thing. And
Tell people what's the difference? What happened to you when you did TMS? Explain to them, how do people feel different in terms of depression?
you can feel. For me, after 12 session, I started already feeling, yeah, everything looks better, life looks better a little bit, colors are brighter,
Okay.
and doesn't seem like hopeless, helpless, and everything is bad.
Okay.
And that's how it started. And I started to recovering, not just in 1 minute, but slowly started getting better, better, better. So I highly recommend for anybody who.
And I saw you as you came in, you were smiling, so you were
Yeah.
feeling much better
Much
with
better,
TMS.
I enjoy life
And you did TMS, but you stayed on medication, so TMS is always with medications.
medication, yeah.
Okay, so it's an add-on treatment to help people
Yes.
with depression. Have you experienced any side effects to TMS?
No, I cannot say that I did.
So the experience was pleasant. You sat
Yes.
there. The machine was not loud, and you did okay.
It's fine.
20-minute sessions. You did the TMS, and you felt that it was very, very helpful.
Yes.
What is your message to people who have chronic depression like you, who feel that the medications are not enough for them? What do you recommend about TMS?
Definitely try TMS if you never did, and be patient.
Okay.
Doesn't mean in one session will something change, but yeah, absolutely, I highly recommend.
Okay.
It's effective and slow.
All right. And we have your permission to show this to other patients and other people so they would benefit from your experience with depression and transcranial magnetic stimulation.
Yes, absolutely.
Thank you.
Thank you.
The history of TMS really demonstrates that the utilization of TMS by experienced hands, in addition to medications, can really assist individuals in treating their depression. Now, one may ask, well, what about side effects? Every treatment modality has side effects. What happens to me with TMS? Is it the same side effects that I get with medications? That could have nausea, vomiting, that could have gastrointestinal symptoms, that could have movement disorders, weight gain. Transcranial magnetic stimulation is a safe treatment, basically except for a little bit of pressure in the application of the TMS machine. Most people experience very little adverse effects. There are some contraindication. For example, an individual who has a history of seizures or has a seizure disorder, we would worry that transcranial magnetic stimulation may worsen or may induce a seizure. So we basically stay away from individuals who have a history of seizure or potential for seizure with TMS because of the likelihood of inducing seizures. But for the majority of individuals who receive TMS, it is a safe treatment. Sometimes they can have headaches from tension from the magnetic field, but most of the time they experience very little adverse effects. And this is in stark comparison with neuropharmacology that we employ in our patients. This is the wave of the future. We are basically employing new treatment modalities to treat psychiatric illness. Basically, within a few years, the majority of psychiatric illness will have a treatment modality utilizing magnetic fields, utilizing direct stimulation, because we want to be able to move away from a biological component, from medication treatment that have a lot of adverse effects. We know that 1 out of 4 Americans are in a psychotropic medication. And by psychotropic medication, I mean antidepressants, anti-anxiety medications, mood stabilizers, antipsychotic medications, medications for ADHD, medications for adverse effects. We want to be able to move away from that. And transcranial magnetic stimulation really promises to be a significant modality that would help us be able to understand that there are other treatment regimens. It is rapidly becoming a main part of the standard of care. Now, transcranial magnetic stimulation right now is mostly reserved for individuals who have what we call treatment-resistant depression. But we are thinking that in the future, it's going to become a first-line treatment for individuals with depression. And we have tremendous response rates. Response rates are as good as 65 to 75%. So 3 out of 4 individuals who have treatment-resistant depression will respond to transcranial magnetic stimulation. In order to get transcranial magnetic stimulation, you need to see a psychiatrist, you need to have an evaluation, and you need to have a good discussion in terms of the risks and benefits of the treatment. For most individuals, insurance would cover it. The price have gone down significantly that individuals are able to afford it out of pocket. I have been doing transcranial magnetic stimulation in my practice for the last 10 years, and it has shown tremendous results in helping many of my patients in their treatment for depression, for anxiety, for obsessive compulsive disorder, and for those individuals who are suffering with addiction. I'm hoping that I am going to be able to continue to provide that treatment modality for my patients and to tell you about the future of psychiatry. Stay tuned for our next episode for Unmuted, the Diaries of the Virtual Psychiatry. We're going to be continuing to telling you stories about the field of psychiatry, the history of psychiatry, and my journey during this field. Thank you.